Hey guys, I just wanted to give a big shout out to Anchor. Now that it's my second year of podcasting, I thought you all should know that I've only used Anchor to record all of my podcasts. And if you haven't heard about Anchor, it's simply the easiest way to make a podcast. Let me explain. It's free. There are so many creative creation tools that allow you to record and edit your podcast right from your own cell phone and your own computer. Anchor then does the hardest part for you. They go ahead and distribute your podcast so it can be heard on Spotify, Apple Podcasts, and so many other platforms. Now, I think it's everything you need to make your own podcast in one place. So what are you guys waiting for? Go ahead and download the free Anchor app today and head on over to anchor.fm to get started. Have fun. Hey everyone, welcome back to all my listeners. Hope you're all having a great day so far, and if it's your first time finding me, thanks so much and welcome. Welcome to episode 15 of my 4th season. Today is Wednesday, December 8th, 2021. My name is Sonal Patel, and this is the Paint the Medical Picture podcast series. Now, I'm finally looking forward to my on-site, in-person conference in a few days. Now, I've made these plans a few months ago before this Omicron variant was identified. Oh well, fingers crossed, I'll just continue doing my part and keep washing up and masking up. Now, in my compliance tip today, I dive into a new series on back to basics with some of my trusted resources. And today is also the second Wednesday of the month, where I share my very newsworthy OIG Work Plan update for the month of November. And I round out today's episode with a remarkable quote on illumination from the beautiful words of Thomas Aquinas. If you've checked me out on LinkedIn, you know I'm all about compliance and protecting our physicians and valued healthcare professionals when it comes to the business of medicine. I hope this week with me brings you enough to take back to your organizations, to want to dive in deeper, to use my tips and best practices to ensure success. I hope this podcast will help you boost the quality of documentation capture and improve coding accuracy as you help your providers paint the medical picture. If you like what you're hearing, go ahead and hit that subscribe button now so you don't miss another episode. Please write in a review and kindly drop me a 5-star rating on Apple Podcasts or wherever you listen to my podcast. I'd really love your support. And as always, a friendly disclaimer. Remember, I'm bringing you the news, current healthcare industry news, my compliance tips and recommendations based on my over 10 years of experience in front office, back end, coding, and billing for multi-specialty physicians, compliance, and auditing for both E&M and surgical operative reports. These are my opinions alone and are not to be construed as legal advice. So, let's get into Newsworthy. I wanted to go over the 12 new November 2021 updates made to the OIG Work Plan. The first is titled Cybersecurity Testing of HHS and Consumer Mobile Applications. Now, this is an audit coming from the Office of Audit Services. Various HHS operating divisions, or OpDivs, use mobile applications as alternative ways to reach mobile device users. Cybersecurity researchers have indicated that a large majority of Android and iOS apps across every industry lack the most basic security protections. HHS OIG will perform a series of penetration test audits of certain mobile applications to determine whether security controls protecting HHS and its OpDivs mobile applications are effective in preventing certain cyber attacks. Also, as part of this work, the OIG will determine whether HHS and its OpDivs are following required security standards and policies for the development and vetting of these mobile apps. HHS OIG will perform this work because of the steady increase in the use of mobile apps by HHS and its OpDivs to provide access to health services. This final report is expected in fiscal year 2022. Now, the second OIG Work Plan update for November 2021 is titled CDC Oversight of the President's Emergency Plan for AIDS Relief Funds. This audit is coming from the Office of Audit Services. Now, the Centers for Disease Control and Prevention, that's our CDC, has been working to combat HIV since the start of the HIV epidemic. As an implementing agency of the President's Emergency Plan for AIDS Relief, known as Pepfar, CDC works side by side with foreign ministries of health and other partners, leveraging its scientific and technical expertise to help deliver high-impact, sustainable HIV treatment and prevention services to millions of people in the countries most affected by HIV. CDC received more than $5.5 billion in Pepfar funds during fiscal year 2018 through fiscal year 2020, which is an amount equal to about 96% of the total Pepfar funds received by HHS during these 3 fiscal years. To accelerate HIV treatment and prevention worldwide by using public health, innovation, and data-driven approaches to achieve the global goal of HIV epidemic control. To date, the HHS OIG has conducted 10 audits of CDC's Pepfar oversight operations in 5 countries on 3 continents, those continents being Africa, Asia, and North America. OIG's Pepfar oversight has helped CDC and other HHS staff members learn important grant and program integrity lessons that apply to ongoing and future responses to infectious diseases. In previous audits of CDC offices in the U.S. and foreign countries, OIG identified noncompliance with policies, inadequate monitoring of grantees, and internal control weaknesses in the awarding of Pepfar funds. The OIG will determine whether CDC, number 1, effectively awarded, monitored, and accounted for Pepfar funds in accordance with federal and departmental requirements, and the Office of U.S. Global AIDS Coordinator and Global Health Diplomacy guidance. And number 2, the OIG will also determine if they followed established processes for the reprogramming and or the redirection of Pepfar funds used for COVID-19. The audit of controls over reprogramming and or redirection of Pepfar funds for COVID-19 will be a collaborative audit conducted by HHS OIG and the U.S. Agency for International Development's OIG. Each of these OIGs will issue separate reports. These final reports are expected in fiscal year 2022. Now, the third OIG Work Plan update for November 2021 is titled COVID-19 Pandemic Relief Funding and Its Effects on Nursing Homes Case Study. This analysis is stemming from the Office of Evaluation and Inspections. Now, Congress and HHS used the Provider Relief Fund, the PRF fund, to support nursing homes and other healthcare providers during the COVID-19 pandemic. Nursing home residents have suffered some of the highest rates of COVID-19 infection and mortality during the pandemic. HHS allocated $10 billion from the PRF fund directly to nursing homes through 2 channels. The first channel being a distribution to skilled nursing facilities for lost revenue and expenses related to preventing, preparing for, and responding to COVID-19. The second channel being the nursing home infection control distribution for improving infection control practices and reducing rates of COVID-19 infection. This review will use interviews and other data collected as part of 6 case studies organized by the Pandemic Response Accountability Committee. The OIG will identify how nursing homes use the funds to support their COVID-19 response, improve infection control practices, and assess selected outcomes from that use of funds. Their work will also evaluate the Health Resources and Services Administration's, that's HRSA's, oversight and efforts to enforce PRF terms, conditions, and reporting requirements. This final report is expected in fiscal year 2023. Now, the fourth OIG Work Plan update for November 2021 is titled Network Cyber Threat Hunting, audit of the HHS Trusted Internet Connection and Select Operating Division networks. This review is coming from the Office of Audit Services. Now, in recent years, HHS has been the target of numerous cyber attacks, which has affected HHS operations and demanded additional resources to combat the growing cyber threats. The cyber attacks have increased in complexity and frequency and at times evade cybersecurity defense tools. In accordance with the Federal Information Security Modernization Act and the Executive Order on Improving the Nation's Cybersecurity of May 12, 2021, the federal government must detect and respond to threats that can potentially affect the confidentiality, availability, and integrity of its services and data. Failure to do so may result in service disruptions and breaches that could potentially affect the security and privacy of public health data or U.S. citizens' personally identifiable information. The OIG will perform a series of information technology audits at HHS and selected operating divisions to determine whether their network cybersecurity defenses are effective. This final report is expected in fiscal year 2023. Now, the fifth OIG Work Plan update for November 2021 is titled Audit of the Food and Drug Administration's Pre-Market Tobacco Product Application Process for Electronic Nicotine Delivery System Products. This analysis will be conducted by the Office of Audit Services. Now, the Food and Drug Administration, that's our FDA, is responsible for regulating tobacco products. Under Section 910 of the Federal Food, Drug, and Cosmetic Act, the FD&C Act, manufacturers wanting to market a new tobacco product must first obtain a marketing order. Those seeking a marketing order for a new tobacco product may submit a pre-market tobacco product application, a PMTA, to the FDA. The FDA has received PMTA submissions from manufacturers of electronic nicotine delivery system, ENDS products. Now, Section 910B1 of the FD&C Act contains the requirements for a PMTA submission. In FDA's assessment of PMTAs, the FDA must determine whether the new tobacco product is in fact appropriate for the protection of public health. The OIG's objectives are to determine, number one, if the FDA's progress on reviewing applications for ENDS products. Number two, whether the FDA's policies and procedures ensured that marketing orders were granted or denied for ENDS products in accordance with federal statutes, regulations, and guidance. And finally, third, what actions did the FDA take or have they taken to ensure that ENDS products that are not appropriate for the protection of public health are not marketed. This final report is expected in fiscal year 2023. Now, the sixth OIG Work Plan update for November 2021 is titled Audit of Unaccompanied Children Data Cybersecurity Controls. This analysis is being conducted by the Office of Audit Services. The Unaccompanied Children, the UC program, is operated by the Office of Refugee Resettlement, the ORR, within the Administration for Children and Families, the ACF, and it provides temporary shelter, care, and other related services to unaccompanied children in its custody. ORR uses the Unaccompanied Children Portal, the UC portal, and other data sources to maintain information on over 100,000 unaccompanied children. The OIG will determine whether ACF has sufficiently addressed findings identified during a previous Unaccompanied Children Portal audit, implemented controls to ensure the cybersecurity of sensitive UC data in accordance with federal requirements, and incorporated adequate system development lifecycle planning to ensure that the UC portal aligns with business and performance objectives. This final report is expected in fiscal year 2023. The seventh OIG Work Plan update for November 2021 is titled Medicare Payments for Inpatient Claims with Mechanical Ventilation. This audit is being conducted by the Office of Audit Services. The OIG will review Medicare payments for inpatient hospital claims with certain Medicare Severity Diagnosis-related groups, or MSDRGs, assignments that require mechanical ventilation to determine whether hospitals' DRG assignments and resultant Medicare payments were appropriate. Mechanical ventilation is the use of a ventilator to take over active breathing for a patient. For certain MSDRGs to qualify for Medicare coverage, a beneficiary must have received more than 96 hours of mechanical ventilation. OIG review will include claims for beneficiaries who received more than 96 hours of mechanical ventilation. Previous OIG reviews identified improper payments made because hospitals inappropriately billed for beneficiaries who did not receive at least 96 hours of mechanical ventilation. This final report is expected in fiscal year 2023. The eighth OIG Work Plan update for November 2021 is titled Medicaid Inpatient Hospital Claims with Severe Malnutrition. Now, this is an audit stemming from the Office of Audit Services. Malnutrition can result from treatment of another condition, inadequate treatment or neglect, or general deterioration of a patient's health. Hospitals are allowed to bill for treatment of malnutrition on the basis of the severity of the condition, mild, moderate, or severe, and whether it affects patient care. Severe malnutrition is classified as a major complication or comorbidity, MCC. Now, adding an MCC to a claim can result in an increased payment by causing the claim to be coded in a higher diagnosis-related group. The OIG will conduct statewide reviews to determine whether hospitals complied with Medicaid billing requirements when assigning severe malnutrition diagnosis codes to inpatient hospital claims. This final report is expected in fiscal year 2023. Now, the ninth OIG Work Plan update for November 2021 is titled CMS Oversight of Manufacturer Reported Average Sales Price Data. Now, this is an audit from the Office of Evaluation and Inspections. CMS's review of manufacturer reported average sales price, ASP, data is a vital component of its oversight of Medicare reimbursement for Part B drugs. CMS uses ASPs reported by manufacturers to calculate Medicare Part B drug reimbursement amounts paid to healthcare providers. Congress has directed the HHS Office of Inspector General, the OIG, to submit a report to Congress no later than January 1st, 2023. That includes an assessment of the accuracy of ASP data submitted by prescription drug manufacturers and recommendations for how to improve the accuracy of that data. This report will identify any potential gaps in CMS oversight and potentially make recommendations to improve the accuracy of number 1, the ASP data reporting, and number 2, Medicare payment amounts calculated from that data. This final report is expected in fiscal year 2023. Now, the 10th OIG Work Plan update is titled States' Use of Local Provider Participation Funds as the State Share of Medicaid Payments. Now, this is an audit from the Office of Audit Services. Local units or jurisdictions of government have the option to use local provider participation funds, or LPPFs, to generate and collect local funding to finance the state's share of Medicaid supplemental and directed payment programs. In the past several years, some states and local units of governments have increasingly used LPPFs to fund the state share of Medicaid payments. As such, the OIG will determine whether the LPPFs the state agency used as the state share of Medicaid payments were permissible and in accordance with applicable federal and state requirements. This final report is expected in fiscal year 2023. Now, the 11th OIG Work Plan update for November 2021 is titled Identifying Denied Claims in Medicare Advantage Encounter Data. Now, this is coming from the Office of Evaluation and Inspections. CMS requires Medicare Advantage organizations, MAOs, to submit records of all services provided to beneficiaries to CMS's Medicare Advantage Encounter Data system. These records often, although not always, begin as claims for payments that healthcare providers submit to MAOs. MAOs must submit all records of services to CMS, including records of denied claims, which means claims for which an MAO determines it had no responsibility to pay the healthcare provider. CMS does not require MAOs to differentiate between paid and denied claims when submitting encounter records. Now, in the absence of requiring a denied claims indicator, CMS requires each MAO to submit claim adjustment reason codes that contain information about how the MAO processed the claim and may be a helpful but not definitive method for identifying denied claims. The lack of a definitive method to identify denied claims in the MA encounter data may limit the use of these data to ensure MA program integrity and quality of care. This work will do two things. First, it will determine the extent to which the MA encounter data contained potentially denied claims. And second, it will also identify any challenges to MA program oversight that result from the lack of a denied claim indicator on services in the MA encounter data. This final report is expected in fiscal year 2022. Now, the 12th and final OIG Work Plan update for November 2021 is titled National Background Check Program for Long-Term Care Providers, an interim assessment of Idaho and Mississippi. This analysis is stemming from the Office of Evaluation and Inspections. Now, Section 6201 of the Patient Protection and Affordable Care Act, or ACA, established the framework for the National Background Check Program. This program, administered by CMS, provides grants to states to implement background check programs for prospective employees and providers of long-term care services. Now, this ACA requires OIG to evaluate this grant program after its completion. For continuing participants in Idaho and Mississippi, the OIG will review the implementation of program requirements for conducting background checks on prospective employees of long-term care facilities and providers who would have direct access to patients. They will determine the costs associated with each state program and determine the checks conducted during the program. This final report is expected in fiscal year 2022. My goodness. Wow, right? So once again, this month of November proves to be exhausting. The OIG, however, never exhaust themselves. They never tire, do they? They're always working on this myriad of audits and inspections that I deliver to all of my listeners. Now, despite the lengthy public state of emergency that we're all still enduring, they just keep working. So with this newer, fresher Omicron variant, the PHE may very well stay on into 2022, right? But now I always, of course, understand this latest malnutrition audit being conducted on the Medicaid side of inpatient claims. Medicare has had a similar audit in the past for severe malnutrition and marasmus as diagnoses with MSGRGs that greatly increase payments on claims. And the big audits for cybersecurity, I'm very much interested to see what these final reports reveal on how technology can help us do better in detecting the threats before the full-blown breaches actually occur. What kinds of preventive measures can be implemented? What new and improved tools can we start installing that will thwart these types of cyber criminals? So, in my opinion, I always pass this critical information on to my providers who need it to review their coding and billing practices or overarching compliance programs. I think these reports with findings are always most interesting and informative, and I always look forward to analyzing them in the years ahead. It's also important for my listeners to pay attention to these monthly OIG Work Plan updates to see how they may impact you, your provider, or your health system. So please stay tuned for my monthly OIG Work Plan updates. They drop the second Wednesday of each month. And now it's time for my best practice tips in Trusty Tip. So I thought I'd provide us with a new series on focused best practice tips in what I call Back to Basics. So today I wanted to go over a few of my trusted resources. Hopefully you can tell by now, after 4 seasons with me, that the OIG Work Plan is one very big staple in my toolbox. The Medicare or CMS website is also huge. It's a huge source of information Remember all those FAQs they put out during the pandemic, early in the pandemic? They were so confusing, right? Remember in the very early months, all those changes were coming in fast and furious every third day or so. We had no idea what change occurred when until they put a date at the bottom of the document, right? Huge. It made such a big difference. Something so small, but made a big impact. Now, then there's also those trusted list serves you should be getting on from the AMA, that's our American Medical Association, to those listservs from the AAPC and AHIMA. And let's not forget about your Medicare Administrative Contractor, your MACs. Make sure you subscribe to their news alerts as well. And how about if you have Blues as a payer, any one of those anthems, Blue Cross Blue Shields of whatever state, make sure you get on their provider email subscriber list as well, because they have quarterly newsletters and goings-on that are huge and so very informative. Now, you can also be checking the latest issues and updates from great online magazines as well, like HFMA and Modern Health and HIPAA Journal. Now, you should also be following and listening to my amazing colleagues in this industry who have podcasts and great voices too, like there's Sean Weiss, and you can get the royal treatment from him in compliance. There's also Terry Fletcher for her unabashed expertise in cardiology coding. And don't forget about Victoria Mole for her legendary teaching on YouTube. There's also Jennifer McNamara for her good deeds in practice management. And don't forget about Karen Weintraub on things fraud, waste, and abuse. Now, I consider these folks to be trustworthy and reputable. And as always, though, be mindful and perform your own due diligence, right? Now, I have tons of other colleagues who may not have a podcast, but their reputations are legendary. They write articles, they publish books, they're national speakers, they provide so much value to this space of healthcare. So you too should have conversations and start networking with leaders in the industry. Amazing, right? I hope these back to basics should remind you that there's so many trusted resources out there that you should be utilizing to maintain compliance. Now, I've only provided you with a snippet, the bare bones of the many resources and people that I have in my toolbox. So, a better, smarter approach is always one that's proactive and starts by painting a clear, rich, and vibrant medical picture the first time, so your certified medical coder can then abstract codes with accuracy. And finally, in this week's inspiring quote in Spark is from the Italian theologian Thomas Aquinas. Better to illuminate than merely to shine, to deliver to others contemplated truths than merely to contemplate. Remarkable, right? I think this is an amazing quote that reminds us about the importance of illumination. Thomas Aquinas reminds us that it's often better to reverberate with light, to illuminate from within. He reminds us that the shine is superficial and only on the surface. We have all that light, that brightness within us. It is because of that inner light that we can see the brightness all around us, outside of us. When we are illuminated from within, the possibilities for ourselves are limitless. I am happy Thomas Aquinas' spark still burns brightly in all of us today. So that wraps up today's episode. Please go out and make this a great day, an incredible week for yourselves. Aim a little higher, do a little more, and give back in any way you can in 2021. There's so much each one of us can do. Now, in my final note today, remember that new variant is flying around, so please consider getting vaccinated to protect yourselves and one another. I know now, well, I hope someone will now give me my booster. It's exactly 6 months from my full vaccine load. I was shocked when they turned me away last month when I tried to get my booster. Too soon, they said. Too soon. Now, this new Omicron variant is here. It's parked here for a while, so please try and stay vigilant. I know it's hard. It's been hard, right? For 18 plus months. We're all so tired of this new normal, but let's do our part and keep washing up, masking up, and staying physically distant until we get those boosters in our arms. Now, as always, I appreciate you diving into today with me. And if you want more information from me, go ahead and follow me on LinkedIn. I'll leave links to everything in the show notes below. Please continue staying safe and healthy, practice safety for one and all during our collective, seemingly never ever ending life and times of coronavirus. Thank you so much for listening in on today's episode, and I hope every week with me brings you closer to helping your providers paint a masterpiece. See you next Wednesday. You know, man.